I'm Dr. Cody Porter. I'm a senior lecturer in psychology from UWE Bristol, and today's lecture is going to focus on gender differences. So women are twice as likely as men to have a mental health condition or a mental disorder. And according to the World Health Organization, the WHO, this is due to several risk factors of mental illness that disproportionately affect women, such as gender-based violence, lower socioeconomic status, and lower average income. However, while gender inequality is a cause of mental illness worldwide, gender bias in medical diagnosis is also caused due to doctors more heavily focusing on mental health conditions that cause symptoms for women rather than men. For example, doctors are more likely to diagnose depression in women than they are compared to men, even when they have identical symptoms and even when the depression score is the same. Some critics of the DSM, diagnostic criteria, argue that actually some of the diagnostic criteria are biased towards pathologizing one gender over the other. Now, Broverman and colleagues in 1970 found that US clinicians associated mentally healthy adult behaviour with mentally healthy male behaviour. And this is really important because this illustrates a form of gender bias. Now, as a result, there's a tendency for women to be perceived as less mentally healthy when they don't show male behaviour. And interestingly, some research has indicated that the psychiatrist's own gender might have an impact on their ability to diagnose other individuals. So we're going to look at some examples. Now, starting with schizophrenia. Schizophrenia occurs in men and women, and Kaplan and colleagues in 1994 described the peak ages amongst those having schizophrenia as being between 15 and 25 for men and being between 25 to 35 in women, although it can peak for women in their 40s and 60s. Now, studies overwhelmingly reported that actually early onset age in males is about 3 to 5 years regardless of culture. Men tend to display more negative symptoms. Women tend to display less irrational thinking, but tend to have more affective symptoms. What we mean by affective symptoms is things like emotional problems. So that could be depression, hostility, impulsivity, or having inappropriate behaviours. And researchers in 1995 found that women were diagnosed more frequently with disorganised subtypes of schizophrenia than men. Women were more likely to have delusions of persecution compared to men. So there does appear to be a gender bias. Lorine and Powell in 1988 found that some behaviours which were regarded as psychotic in males were not regarded as psychotic in females. Now, they came to this conclusion by conducting research. They randomly selected 290 male and female psychiatrists. They asked them to read 2 case studies of patients' behaviour. And they asked them to offer their judgments of these individuals using the standard diagnostic criteria. What they found was that when patients were described as male or when patients were described with no gender information, there was a diagnosis of schizophrenia 56% of the time. However, when patients were described as female, only 20% of them were given a diagnosis of schizophrenia. Again, this is an empirical example of gender bias with diagnosing schizophrenia in patients that should equally have been diagnosed. Yet this gender bias did not appear to be evident amongst the female psychiatrists, so that's also really important. Gender bias does occur, and it tends to occur more in male psychiatrists. Now, this suggests that diagnosis is not only influenced by the gender of the patient, but also the gender of the clinician. And gender bias occurs due to clinicians failing to consider that males tend to suffer more negative symptoms than women, and they have higher levels of substance abuse. Females also have better recovery rates and lower levels of relapse. Now, these misconceptions could be affecting the validity of diagnosis, as clinicians are not considering all of the symptoms associated with schizophrenia. Now, let's think about depression for an example of gender bias. Depression is typically diagnosed more commonly in women. And one possibility is that women appear to suffer this disorder more because actually they're better able to talk about it, so they're better able to communicate their difficulties, meaning that they're more likely to be diagnosed with it. This is because it's more socially acceptable for women to talk about their feelings and emotions, which means that it's more likely that they're going to present these symptoms to a doctor. Now, there is evidence that Men express depressive feelings and symptoms, but they do so by taking on unhealthy behaviour such as excessive drinking or aggression in the workplace. So in summary, gender does seem to play a role in mental health diagnosis. Part of this might be due to gender bias as a result of sexism. And what we mean by sexism is prejudice or discrimination based upon a person's sex or their gender. In many cultures, sexism has historically meant that men have power and influence over women and other marginalised genders. Gender bias also impacts the health of men though, and that's an important consideration. It doesn't just negatively impact women. For example, because of positive prejudice, that men are strong and brave, this means that they're more likely to avoid seeking medical help when they are suffering from a mental illness. And this is because they're afraid of being perceived as weak.